Hello, my name is Kendall Hart, and today I'm going to be talking about why nutritious diets are important during pregnancy. So, nutritious diets are important because food fuels the body. While pregnant, a person is eating for two people, so it is important that they eat enough. Many women are unaware that they need to eat more than they normally would so the baby can have food as well. So it is important to eat food that can be turned into energy, such as bananas, eggs, apples, sweet potatoes, and many more. There are many aspects of a healthy and nutritious diet, and that include macro and micronutrients. So, macronutrients are going to be your complex carbohydrates, your lean proteins, and your healthy fats. Some complex carbs that women should eat while pregnant include brown rice, yogurt, oats, sweet potatoes, fruits, beans, and more. The lean protein is going to be your eggs, salmon, turkey, cottage cheese, lentils, any low fat meat that you can find at the store. And then your healthy fats are going to be avocados, nuts, and a big component that people do not realize is that a great healthy fat is using olive oil instead of butter. That's a great way to get in those macros. So, in addition to these key components, vitamins, minerals, and nutrients are also really important to consume while pregnant. The body is changing with a child growing inside, so minerals and vitamins get used a lot more quickly than they normally would if a woman was not pregnant. So, we already get vitamins and minerals from food, but it is important for pregnant women to take them so the baby gets enough. An easy vitamin to take that most doctors actually tell women to take are a prenatal vitamin before getting pregnant and then still while pregnant. So, some vitamins that women can take include vitamin D, calcium, iron, folic acid, and many more. Those are really important to intake because, again, with the baby inside of you, the baby is taking up a lot more than it normally would. So, the woman also needs those vitamins. So, a healthy and nutritious diet can also lead to less complications during and after pregnancy. So, a lack of nutritious diet can cause low birth weight for the child, preeclampsia, and can affect the baby's metabolism. It can also cause high blood pressure in the mother and baby once it's born, and eventually cause obesity later in life. So it can also, a poor diet can also cause chronic diseases such as heart disease, risk of cancers, kidney problems, and many women do not realize that under eating is also a huge component. So even if you are eating healthy and nutritious food, if you're not consuming enough, it can still cause chronic diseases to the child later in life, and then those diseases can travel on to their kids and so on down the family line. So it's really important to be taking those vitamins, eating enough, asking a doctor how much you should be eating, and all of that. So now we're going to watch a video that goes over why a balanced diet is important, struggles that can happen because of an unbalanced diet, and how also being overweight can affect a child.
What if I told you that one out of every five pregnant women in the United States goes to bed hungry? Now, what if I told you that because they went to bed hungry, their babies are now prone to have a chronic disease as an adult? And not only that, but their grandchildren as well. This unfortunate fact is a huge problem.
On the other side of the spectrum, one out of every three pregnant women is overweight. This again has the same negative effect. Their children and their grandchildren will most likely have a chronic disease.
Oh no. Dr. Lawrence D. Longo of Loma Linda University Health is one of the world's most respected specialists in developmental physiology.
His research on maternal health has been funded by the National Institutes of Health for the last 50 years.
Today, we all know that smoking while pregnant has a negative effect on the child. Well, we can thank Dr. Longo for that. His most recent research has been focused on nutrition in pregnant women.
It's a very sobering reality to think in terms of how something that happened during one pregnancy can have effects throughout several generations. One finds a host of diseases related to the cardiovascular system, hypertension, heart attacks, strokes, to aspects of metabolism, type 2 diabetes, and now the whole panoply of neuropsychiatric disorders which are showing up.
Dr. Longo and his team of researchers have studied how protein deprivation during the course of gestation will have these effects on one's health.
I think that as a society, we should give more attention to pregnancy and early life and development.
Now that we know what the consequences can be as our children become adults, we can't stress the health advice enough.
Eat a balanced diet with enough protein and nutrients. Take a prenatal vitamin every day with folic acid and DHA. And if you're overweight, try as hard as you can to get a healthy weight by the time you conceive.
To quote one of my friends at the National Institutes of Health, every pregnant uterus is a center for excellence.
There is your tip for the day on how you can live healthier longer.
Okay, so through this video, we again learned the importance of a nutritious diet, and we also learned about how undereating and a poor nutrition can lead to chronic diseases in children that can be passed on through generations and generations. So throughout this presentation, we learned that many women are unaware that food can affect the baby. Many people don't realize that what they put into their body can translate into their child and can affect them later in life. And this is why more people need to be educated on the topic, men and women, so husbands, boyfriends, whoever can help the women and buy nutritious foods for them as well. So a little tidbit that I have for women that are craving an ice cream cone or a McDonald's cheeseburger or something is to find something that can replace it, but also taste good. So if someone's craving ice cream, they could eat raspberries or some type of fruit. And if someone wants pizza, I love using eggplant as crust instead of normal. It's just a little healthier and it gives you that vegetable as a nutrition. And so to the audience, I just want to ask how you will improve your food intake and how you will continue to eat healthy if you're not already. Exercise is a great way if someone's overweight that they can improve their health. And finding things that you like is also really important. Once you get in the groove of eating raspberries instead of ice cream or using a healthier recipe than what it would normally say, it is a lot easier once you start doing it, but it's just important to get it going. And additionally, vitamins are also great, and anyone can ask their doctor which ones they should use, if there's specific ones or anything. But overall, nutrition is so important for anyone, but especially women that are pregnant and going to birth a child, because obviously everyone wants their child to be healthy and great when they come into the world. So thank you.